shows.
The UN Office on Drugs and Crime released its World Drug Report 2025 today, highlighting that a new era of global instability is creating unprecedented challenges in addressing the world drug problem. These include record high levels of drug use, the growing power of organized crime groups, and an increasing strain on public health systems and governments. My name is Angela Patnode, and I work in the advocacy section at the UN Office on Drugs and Crime. I'm joined here today by Angela May, who's the Chief of Research and Analysis at UNODC, and she's here to walk us through the key findings of the report. Angela, welcome to our inaugural LinkedIn Live, and congratulations on the launch of the report.
Thank you, Angela.
We'll get right into it. So the report discusses drugs in various conflict and post-conflict situations. For example, we have the fall of the Assad regime in Syria and what that means for the Captagon market. And we also have the rise in synthetic drug production in Ukraine during the war there. Yeah. Can you tell us what developments we should be on the lookout for as these situations continue?
Well, you know, we have seen over the years how conflict, instability, weak rule of law is very much linked to drug, particularly drug manufacture and drug trafficking. And also we have seen how the production of synthetic drugs particularly cement in where we have this type of instability. And we see, for example, post-conflict situation like Myanmar, where Myanmar is the center of a production of methamphetamine that feed the whole large market of Southeast Asia. We have seen it in Mexico, that also is the center of the production of fentanyl that feeds North America, but also methamphetamine. And now, as you mentioned, also in areas that are very, in a way, hot areas now in terms of instability, etc., the synthetic drugs particularly has played a very important role, both in also feeding the conflict, because the profit made by traffickers on drugs often are also used, to establish power or certain groups, or to maintain also regime, that otherwise, because we document in the report this year, drugs continue to be the largest profits for organized crime, for groups, and then impact on society in terms also of violence, and not only. But then, in Syria, what is happening? And now we have seen all in the media how something that we know before, but now we saw the pictures, and we could see on videos the large production sites that were in Syria. And producing Captagon. Captagon is a stimulant, an amphetamine, what we call, and is used mainly in the Gulf countries, where it is the main drug of concern there, particularly among young people, but also in part on other parts in the Middle East. And the trafficking of Captagon has increased tremendously over, around 2020, 2021. And we have seen a slight decrease around 2022, but now with the change in Syria, we see actually an increase of trafficking. A lot more seizures that we see at the border with Iraq, with also large seizure up to 2024, now a few months ago, also in Saudi Arabia, millions of pills. And this is an indication that probably traffickers are releasing stocks, or is an indication that manufacture is shifting. And so now we are really looking, and we need really to monitor, because we have been seeing also an increase in the trafficking of Captagon in countries like Libya. And so we are really worried that that kind of instability can, the role of drugs, and particularly of Captagon, but also methamphetamine that is entering the region, could fuel even further that instability. And in terms of war zone, in Ukraine before the war, Ukraine was a country where there was some transit of drugs, mainly heroin and cocaine. The heroin coming from the Balkan route towards Western Europe, and the cocaine coming from the West again through going to Western Europe. And we saw that really after the war, that kind of traffic shifted. And so the war was a deterrent because insecurity, may have pushed traffickers, and we saw really clearly the shift mainly toward the West. But what we saw is that even before the war, there was some small laboratories of synthetic drugs in Ukraine. And we saw that in the war years, these laboratories have increased. We have seen also an increase in the production of the illicit manufacture of, for example, methadone, and also what we call some catechins that are again stimulant synthetic drugs, and similar to what we have seen around the world in terms of conflict, etc., is that also Ukraine is situated closer to large market of synthetic drugs, because we have seen in the last 10 years how the drug market has changed in Eastern Europe, from being dominated from opiates, mainly heroin, now being dominated by synthetic drugs and also what we call new psychoactive substances, so substances that are not under international control but that they can affect the health of the people. And so the geographical location of being close to this big market and this increase, I have to say, not yet at the level that we see, for example, in Myanmar or Mexico or in Syria for Captagon, but is worrying because, again, the geographical location, the capacity of the synthetic drugs, there is the worry that can be expanded. I think the difference between that we see in Ukraine with other countries in conflict is that Ukraine has maintained, despite the war, a kind of a good governance system. So that's probably is also containing the threat of developing a war zone with really large manufacturing of synthetic drugs.
So all of these situations, I think, probably have contributed to one of the report's headline findings, which is that 316 million people used drugs in 2023. That's up from our statistic in last year's report of 292 million. And it seems like quite a significant rise. Can you tell us what's driving this growth?
So there are two elements in this growth. One, in terms of number, is the increase in population. So we have more people on Earth, so we have also more people that use drugs. But inside that increase, there is also an increase on the prevalence. And there is almost a 3% increase in the prevalence in the last 10 years. So that says a real increase in drug use. And there are multiple factors that I can explain this. Some are relating to some specific drugs and some dynamics relating to that specific drugs. For example, cannabis, that remains the most widely used drug, has increased. Continue to increase globally. Even if the good news is that the latest data among adolescents 15, 16 years old in high-income countries, so we're talking about North America and Western Central European, is decreasing. But overall, globally, I mean, we see also a shift that cannabis is becoming more of a drug from the young use to actually more of a young adult. And adult. So we see more an increase among that older age than the younger. But globally, cannabis use continue to increase and continue to increase in an alarming time, because cannabis is not the same substance that we have seen in the market before. It's become more potent and so more harmful. And so we see also around the world more people enter treatment for cannabis. So that's, an increase. Then another is the cocaine that also increase. But there is also a dimension overall on the issue of why drug use is increasing. And research, academic research is clear on the links between mental health and drug use, and particularly what we call drug use disorders. So people that from just starting using, they move to become dependent. And so in a way, that is also the group of the population that we are most concerned, because that's where the health damage also happens. And so there is this estimates that about 50% of people who use drugs are also affected by mental health disorders, and also many certain type of mental health disorder. You have about a high percentage of them they use drugs. So there is really a link, and we have seen, and WHO has also mentioned numbers about 1 billion, more of 1 billion people that have mental health disorders, and how much this also has increased after the COVID-19 pandemic. And so there is also, on that increase on the total number of people who use drugs is also this increase that is probably also relating to the fact that people have also become more vulnerable with all of this, economic and instability, etc. And that is also bringing more mental health issues, and then those mental health issues are also bringing more drug use.
You mentioned instability and economic vulnerability, and I'm wondering whether that's linked to one of our other key findings on cocaine, which is that cocaine has broken all of its own records in terms of production, in terms of seizures, and in terms of use. You mentioned a little bit about the health impacts of drugs, but could you tell us maybe what other sort of impacts this could have on communities or individuals?
Yeah, so as you mentioned, one of the key findings is that indeed with the cocaine, we have reached again another record high. Another record high on production. So now we estimate about 3,700 tons of pure cocaine being produced globally in 2023, and but also an increase that we continue the global number of people who use cocaine. And this has been a combination. This record high is a combination of several factors that happen both at the supply side and to the what we call the demand side. So where the big markets, particularly in Europe and also in North America. And so if in Europe started a certain point about 10 years ago, started to increase the use because of the entering of different groups into the drug trafficking market, so increased competition. And usually when you have increased competition, the price goes down, purity goes up. So the use in Europe started to increase. On the other side, particularly in Colombia, I mean, we have the three main producing countries of coca leaves and then transforming cocaine as Colombia, Peru, and Bolivia. And particularly in Colombia, after the peace process with the FARC, the FARC has dismantled and also abandoned also the coca cultivation, but that also triggered a series of other groups entering the market, much more also violent, not among themselves and also against the government, but also more efficient in the production. And so they started to have more concentrated cultivation, more concentrated production, more efficient. So now they produce more cocaine out of the same amount of hectare. And so that has, again, on the supply side, started this cycle. And now we have this, we have an increase in demand that is calling for more supply, and we have an increase in supply that push more cocaine. And what is most worrying about is the expansion of the cocaine market in what so-called non-traditional market, particularly Asia and Africa. And we see more people, you mentioned about the impact of drug use. And we see, for example, the increased impact of cocaine in the more people that enter treatment for cocaine. Now, for example, certain countries, few countries in the European Union, now they have the majority of the people that enter treatment is for cocaine. That before was heroin, then cannabis also. But we saw this also happening in Africa. More people enter treatment, but then shows how this the cocaine is becoming more harmful. In Europe, there is also an increased use of crack cocaine that is again more harmful, that creates dependence more quickly, and also at the end also is more harmful for the health. But also in Asia, and again, more people, and actually something that has not been seen in previous years, people register using cocaine, register as drug use in China, or also in Japan, or so that, and Asia is the most populous country, region, and so even a tiny increase in the percentage, that means a lot more people. But again, if this if this market starts, now of course is also particularly among the most affluent population, but this can create, again, will create more demand. That means that we'll create more demand in Latin America. And the impact on community in Latin America is profound, because it's not only the violence that we see in Latin America, not only in some part of Colombia, where groups are violently imposing their presence, and so you see also a lot of, for example, the killing of human rights defenders, killings of environmental advocates in the region, because they are destroying. We have documented how this drug trafficking and the production is not only producing a bit of deforestation, but is also then empowering group to go into also other very profitable markets like environmental crimes, the illicit deforestation, wildlife trafficking. Then they destroy the environment. So the impact on the community of these groups that are empowered with the profit of the drug trade, that really they have, so they are hijacked by the power of a group that control them, and also they see their community being harmed, and also the environment around them, from which there are a lot of indigenous also population in the Amazon region, for example, that have been trapped into this system. And in this World Drug Report, we have also looked at how organized crime groups are structured and the different characteristics that they have, because we really wanted to help law enforcement to understand how effectively go after these groups, because we see sometimes that indiscriminate action by law enforcement do not always work. Simple seizures, stopping seizure, of course, is always this part of the law enforcement work, but they don't destroy the market. And so we really have documented this year ways that hopefully will help law enforcement to understand how it's important first to understand the dynamics of these groups. And they are different. There is not one group that is the same as the others. Each have certain characteristics. And for each of these characteristics, there are different strategies that work. So we hope that with the report really will be helpful, not only for to the law enforcement to have more targeted responses, but also will be helpful to the communities out there that help also people with that use drugs, with drug use disorder, to design better policies and to really understand more how to deal with prevention, particularly how to prevent the drug use from the start. And then even when drug use is started, how can communities prevent the progress from just the drug use to drug use disorder, so to more frequent, etc. When then once you get into the dependence and people are trapped into that, and so we hope the World Drug Report will help.
Well, one last question. You've outlined a lot of concerning trends in this year's report. Wanting to quickly ask whether there are any positive developments that can be found in the World Drug Report, any areas of improvement that we've seen?
Yeah, I think there are maybe two linked good news. One that we have seen now, we are looking at the decrease of the fentanyl market in North America. I think many have seen the devastating effect of fentanyl in North America, 100,000 overdoses deaths. We see that now, really for the first time, we see the deaths, the number of deaths decreasing, both in the US and in Canada, but also the US authorities reporting that they see less fentanyl coming. And they mention as a result the awareness of particularly those that produce chemicals, the precursor for manufacturing fentanyl, becoming more aware of international control. And this is the other kind of positive news on how the international control system works to restrict the spread of new substances. And so, saying that the control of the precursor of fentanyl, now with international pressure, and also particularly the efforts of all the countries, particularly in Asia where these precursors are manufactured, on how this pressure now see that there is less chemicals arriving in Mexico and therefore less fentanyl produced and then less going. And the impact, we already see it in less people dying. But overall, we see that the spread of new substances, those that are not under international control, they come to the market. Sometimes they can be very dangerous because people may not even know what they are taking. But we see that again, the countries have been able to sit together, and every time there is a threat of substances emerging as threatening, they are able to control it. And we see it disappearing from the market. And so we still see that the majority of the people, the majority of the impact, health impact, being overdoses, deaths, or people in treatment, or they still remain confined to the internationally controlled drugs. And we see that now, for example, the big threat that we see in terms of new substances is the emergence of nitazines. And so everybody has been concerned about fentanyl, but now actually we see that around the world, in all basically regions in the world, from Europe, North America to Africa also, and also part of Asia, these nitazines are even more potent than fentanyl. Some of these nitazines is a group of substances, they can be 500 times more potent than heroin. So, and we have seen that this have been causing already some overdoses deaths like in the UK or in some Baltic states. And we have seen also of how this nitazines has also been used in this substance that is called kush. That has been of the main concern in parts of Africa, and so. But we see that the international community has already reacted and already put a number of nitazines under control. And we have heard that for, probably in celebration also of the Day Today Against Drugs, also China has put under control a number of nitazines. So you see how, I think in that sense, the positive news is that despite many divergences that we see politically and geopolitically today among countries, at least in the area of drugs, when there is a matter of defending and maintaining the health of mankind, as the convention are mentioning, they're still able to sit together and actually, produce something that we see the impact today.
Well, that's great. To end on some positive news, I could talk to you about a lot of these points for a lot longer, but unfortunately that's our time. Thank you for all of you who tuned in at home, and please, for more, go to unodc.org to read the entire World Drug Report 2025. Thank you and goodbye.